Hi, my name is Jeffrey Norris. I'm a urologist in UroPartners, and I practice general urology, but I have a special interest in female urology and voiding dysfunction. There are several ways that we treat urinary incontinence. Urinary urge incontinence is most often treated starting with dietary modifications. That means trying to reduce caffeine intake, for example, or not drinking large amounts of liquid before you leave the house so that you don't find yourself in a situation where you suddenly have to go to the bathroom and there's no bathroom in the vicinity and you're at risk of having that kind of an accident. There's also medications, oral medications that can be used effectively to treat this problem, and exercises of the pelvic floor that we can teach patients how to build exercises and inhibit that strong urge to urinate. And then there's also what we call advanced therapies to treat this problem, which refers to either injection of the medicine Botox, which many people have heard about, into the wall of the bladder. It's a minor procedure done in the office, or implantation of an electrical stimulator, kind of like a pacemaker that we use to control abnormal sense of urgency in the bladder. There are other treatment options available as well that we discuss when patients have failed some of the more basic therapies. Again, we start out sometimes talking about exercises that can be done to strengthen the muscles of the pelvic floor. And by using these muscles effectively, the unwanted loss of urine during activity can be prevented. And then there's also outpatient procedures that we do, either involving injecting what we call a bulking agent, looks kind of like a paste, into the wall of the urethra, which closes off that channel so there's a little more resistance to that pressure that's exerted on the top of the bladder during physical activity, and hopefully that can prevent the leakage of urine during those instances. And then probably the most common, again, minimally invasive procedure that we do is referred to as a sling procedure. And that involves a very thin tape. There are different ways of doing the surgery, but the most common method involves a very thin tape that's placed underneath the urethra through a small vaginal incision and just supports the urethra like a sling, just like it sounds. When somebody comes in either embarrassed or ashamed about not being able to hold their urine, and especially if they've curtailed some of the activities that they enjoy doing, and then they come back and they're not wearing pads or they're not having accidents and they can bowl again or dance again or laugh and not have to worry about having leakage, they're very happy, and that's a rewarding part of my job when I see that response.